Welcome to the Clearanail Top 10 Clinical Tips. Clearanail will be introduced, giving an overview, its indications, safe use and top tips on how to use it. This is the Clearanail unit. Clearanail works best for confirmed subungual onychomycosis. Onychomycosis is only responsible for 50% of nail dystrophies. If deciding to go ahead with Clearanail treatment, always ensure you have established the diagnosis of onychomycosis before proceeding. Ensure the single-use microcutter or SUM is properly loaded into the handpiece and is retracted inside the nose cone. To test the device, hold it upside down while pressing the button on the work surface. The microcutter should extend by 1 mm and then fully retract below the tip of the nose cone. Patient positioning is key. The most effective method is for the patient to place their foot flat whilst drilling from a vertical angle. The patient may sit in a chair with their knee bent and foot flat on a horizontal surface. Prior to commencing drilling, ensure that the handpiece is held perpendicular to the nail plate and held steady during drilling. During treatment, keep your finger firmly on the activation button during drilling. Pay attention, as release of the button will cause the SUM to retract. Don't worry if the handpiece gets warm. This is normal. How far should the holes be apart? There is no wrong answer for this, but 2 to 3 mm is close enough. And the following advice may help. Here we see a nail with a mild lateral infection, highlighted in yellow. The holes should be made into and around the infected area. Before use of antifungal, infected area of nail is orange in colour. After use of antifungal, infected area of nail has changed colour and crumbled. Advanced infections, where the infection is established in the nail root, may be treated by producing holes close to the cuticle. Once the infection in the root has died, the nail will start to grow more quickly and the cuticle may repair. Here you can see the cuticle is damaged prior to treatment, and it has healed post-treatment. Patients should avoid all use of nail varnishes and lacquers during treatments, as these can block the holes. Here you can see a patient who has applied the varnish, but it has lodged in the holes, and so any antifungal applied here cannot reach the infected area. How quickly should I see a response? Normally, a colour change is the first thing that is observed in 2 to 8 weeks. Remember, the more fungus present in a nail, the slower the growth rate. Patients should be advised of this. Are there any alternatives to terbinafine 1% solution? Terbinafine is superior in speed of action and spectrum of activity. Clotrimazole and griseofulvin are also available as solutions but untested. The use of tea tree oil should be avoided in onychomycosis. What is the suggested treatment regime once a diagnosis is established? Week 0, drilling of the nail. Review week 8, assess progress. Review week 16, assess progress and discharge if satisfactory. Take photographs at each stage to track progress. At the first appointment, the patient is advised to apply terbinafine 1% spray daily until the next appointment. 8 weeks later, the patient is reassessed and a colour change and some progress with new clear nail growth should be noted. If, however, infection is still suspected to be active, further holes can be drilled around the area, particularly if any were missed at the first appointment. The patient, if advised, may continue to use the spray daily if required. At week 16, sufficient progress should be seen to allow the patient to be discharged and advised to return if the condition does not continue to grow out of the nail. It is key to advise the patient on good antifungal skincare on a regular basis with an antifungal. Otherwise, the nail infection may quickly relapse. Shoes can also be sprayed with the Turbinifine 1% spray as an extra precaution. The following cases have been treated with Clearanail. Thank you for watching the Clearanail Top 10 Clinical Tips.